What he's saying actually about bringing down the deficit. Nothing since 1993 has been projected to reduce the deficit as much as this bill does. Do you remember how when President Bush took over from President Clinton handed him a huge, big budget surplus, which Bush then turned into giant deficits? Nothing has been as good as this health reform bill for the deficit since the time of Bill Clinton. In response to the good CBO report and the cover that it gives to any Democrats who might have been wavering on their vote on fiscal grounds, in response to the impending passage of health reform, Republicans who are opposed to health reform today got a little weird.
I want to send a couple of messages to my colleagues in the House. If you voted no and you vote yes and you lose your election and you think any nomination to a federal position isn't going to be held in the Senate, I've got news for you. It's going to be held.
Senator Tom Coburn, as principled as ever, pledging to place a hold, see if you can follow this, on any House Democrat who votes yes on health reform and then loses their reelection bid and then gets offered a federal position by President Obama while Tom Coburn is still in the Senate. So in other words, you've been warned. Your potential nomination that comes after you vote yes, then potentially get voted out of office, will be held up. Also, Tom Coburn promises to never give you a ride if he sees you hitchhiking in Oklahoma someday, unless he's already going that way anyway. The news that the bill will cut the deficit by more than expected, will cover more people than expected, and will cost less than expected seemed to catch opponents of reform off guard today, because in some cases they are still reading from the old talking points.
This program not only does not control costs on a federal level, but it also does not control it on the state level. It is bad for taxpayers.
You're still going to spend $1 trillion to impose government-run health care on the American people.
This bill spends too much. It taxes too much. It costs too much.
That guy right there, the last guy there was Phil Gingrey. He was the one at the end, right after John Boehner. Phil Gingrey expressing his grave concern about how much this costs. To be clear, the CBO is now projecting that this bill will cut the deficit by $138 billion over 10 years. You can see it right there. $138 billion, not added to the deficit, but subtracted from the deficit. This is the same Phil Gingrey and the same John Boehner who voted for the Medicare Part D drug benefit in 2003. When the CBO scored that bill, at that time, the CBO said that bill would raise the deficit by $394 billion. And yet, Phil Gingrey and John Boehner, now so piously concerned about how much things cost, happily voted for Medicare Part D anyway. When Republicans passed the Bush tax cuts that same year, the CBO score of that one, at that time, said that legislation would raise the deficit by $349 billion. And Republicans, including Phil Gingrey, had no problem voting yes. When Republicans passed the first Bush tax cuts in 2001, the CBO score of that one, at that time, said it would raise the deficit by $1.3 trillion. Trillion with a T. And Republicans, including John Boehner, went along for that ride, too. So let's just make sure we're here on the same page, okay? Phil Gingrey and John Boehner say yes to adding $400 billion to the deficit for Bush's Medicare thing, yes to adding $350 billion to the deficit for Bush's first tax cuts for rich people, yes to adding $1.3 trillion to the deficit for Bush's other tax cuts. Those three votes projected to add $2 trillion to the deficit. Votes yes on all of those. But when confronted with this one, this current one, this health care one, which actually cuts the deficit by $138 billion, this is their response.
We are suffering, as many states are. Our state with about a $2 billion.
Voted against it?
It costs too much.
The math actually doesn't work if you're willing to actually do it. Joining us now is Howard Dean. He's former governor of Vermont, former chairman of the Democratic National Committee. He's now a consultant to McKenna, Long, and Aldridge. He is also the founder of Democracy for America and a contributor to CNBC. Could you possibly have another title or affiliation?
I'm sure I could find one someplace.
It's going to be like showing pictures of the grandkids at some point. We're just going to have to sort of cascade them all down. You were a pretty vocal critic of this health reform effort just a few months ago. What would you say to congressional Democrats who might still be wavering on this tonight?
I think they ought to to vote for it. I think the House bill, the Senate has improved it a lot. But I don't think we can call this bill health care reform, because it really isn't. What they did was expand the existing system dramatically. This is closer to the Romney approach in Massachusetts than it is to anything else. Having said
You'd
that,
call it health insurance reform?
No, it's certainly
reform?
not health insurance reform, because a lot of the stuff that they say is going to be in it, like the pre-existing condition stuff, is going to be very helpful for children and young people, but not for older people, for very technical reasons. Basically, in the bill, there's not a lot of insurance reform. They meant to put some in, but it somehow lost its way in the Senate Finance Committee.
Well, what do you think is the most important thing this bill will accomplish?
There are a lot of important things in this bill that will make it worth passing. The first is it's great for small businesses. If you have fewer than 30 employees, you don't have to pay health insurance at all anymore. And we ought to break the link between employment and health insurance, and that begins that process. Secondly, it is good for the deficit. One figure you didn't mention, which is even more important, is over the following 10 years after the first 10, it reduces the deficit by over $1 trillion. Yeah. So from a financial point of view, it makes a lot of sense. Medicaid is expanded so that indigent working people who can't get any kind of insurance get help now. Children pre-existing conditions on the day the president signs the bill are gone. A friend of mine just had his 9-year-old daughter come down with diabetes. He would lose his insurance policy under the present, for the whole family under the present circumstances. That'll be gone if this bill passes. So even though as a person who's kind of represents the Democratic wing of the Democratic Party, and I think we could have done a lot more, this is worth passing. And the other thing, just to be frank, Rachel, is this opposition, they just lied their way right through this bill. Mm-hmm. I wish that they had sat down and been honest with the American people and honest with us. This is the farthest thing from the government takeover. This is Mitt Romney's approach in Massachusetts. And in Massachusetts' defense, 97% of all the people in Massachusetts are covered. And that's a really important thing to keep in mind. So when you add it all up, I think this bill should be supported. I think it needs to be supported, and I think it's going to pass.
One of the grounds on which you ran for national office for the first time after being governor of Vermont was the fact that you'd been able to achieve almost universal coverage for kids in Vermont.
We have essentially universal. We do not have an individual mandate, which I don't think is necessary. That's in the bill. Look, you can't have the perfect bill, and this isn't a perfect bill. We don't have an individual mandate. We use Medicaid. It's a middle-class entitlement for people under 18, and 96% of our kids have it. 99% are eligible. There's 33% difference. If we'd had a mandate, we would have gotten 99%. But I think people don't like to be told what to do in their personal lives. But the big thing is, this is not a government takeover of health care. That's just a plain lie. And so they were told to say that by a Republican spinmeister, and they've been saying it ever since. And I hope we win this, and I hope when we do that the Republicans will learn that the American people respect the truth. And if you really want to oppose a bill, you ought to do it on truthful grounds instead of making stuff up every 5 minutes because spinmeisters tell you ought to do it that way.
One of the things that we've covered a lot here is how outside groups, both affiliated with the Republican Party and in some cases organized by pharmaceutical companies and insurance companies and other people opposed to reform, how they've
pharmaceutical companies have supported reform.
Sure, but there are, in terms of corporate interests being sort of quietly funneled to outside organized groups, right? And especially these groups that don't disclose their funders, like Americans for Prosperity and others who've organized against health reform. We've covered their tactics. I wonder what you think. What the state of the angry mob is if health reform passes. I feel like Democrats, the initial shock will have worn off about these tactics.
I'll tell you exactly what's going to happen. The same thing that happened when the president sent troops to Afghanistan. 51% of the people didn't want him to send troops. When he did, 55% now support him. The big difference here is in the last 4 weeks, President Obama is back. He started with the Republican Senate. He has been leading this country for the last 4 weeks vigorously, standing up for what he believes in. I think it took a tremendous amount of guts on his part to go back and try this again. A lot of people in his White House staff said don't, and he did it. And he gets credit for that. What people want more than anything else is to see a really strong president. In the last 4 weeks, President Obama has been a really strong president. If they win this, there's a lot of reasons that we're going to win, I think. But the biggest is that he, in the last 4 weeks, has gotten out there and said, this is what we need to do. This is what the American people have to have. And I predict to you right now that if this thing passes, which I think it will by a narrow margin, 10 days from now, the polls are going to show the majority of people are supportive.
Governor Howard Dean, former governor of Vermont, former chairman of the Democratic National Committee. It's always great to have you here.
Pleasure.
Thank you. Appreciate it.
My pleasure.